Start the stream now, and we are live. So, hi everyone, welcome to another Dental Shadowers virtual shadowing session. Today we have our first dental hygienist shadowing session, which I'm really excited about. Thank you, Miss Edith, for being here today and being our first dental hygienist guest, and for this wonderful presentation you prepared for us, and the giveaway that you're hosting, which we will give more details about at the end. So, Miss Edith, whenever you're ready, you can go ahead and take it away.
Thank you. Hello, good evening, everyone. My name is Edith Dana. I'm a registered dental hygienist. I work full-time at a Perio office in Michigan. I've been there in Perio for 8 years now, and I've worked in general dentistry for 1 year before that. This is a screenshot of my Instagram profile, which really summarizes everything there is about me. First of all, it shows my identity at heart. I'm Edith the hygienist. This slide also tells you what I love, which is dental hygiene. I have a passion for it. And a fun fact about my handle, anytime I would contact a patient for a follow-up at work, I would introduce myself to them as, hey, I'm Edith, the hygienist who saw you yesterday. How are you doing? Or anytime patients would call to ask about me at the office, I would say, hey, yeah, can I schedule an appointment with Edith, the hygienist? Or when the office would call them, they would say, yes, I'm calling to confirm your appointment with Edith, the hygienist. So as you can see, my identity was created for me, and I just came and embraced it. So that was really fun. On that note, this slide also tells you what I do, which is education and fun, like what I'm doing for you guys right now on YouTube. I really hope to bring as much value as possible to you, whether you are a pre-dental student or a pre-dental hygiene student. I hope that the information you get today from me will help you throughout your own careers. So this card also tells you where I am and who I collaborate with in the dental industry. And on that note, stand by for a cool giveaway at the end of this session. So if you want to shadow me every day per se, you can follow me on social media. But for now, welcome to this virtual shadowing session with me, and let's begin. All right, so this picture shows the most iconic moment of my career in dental hygiene. This picture was taken on May 18th, 2012 at the Oakland Community College, my alma mater. This is the Highland campus. This is the honor students ceremony for students who finished their programs that year. And that lovely lady there is handing me the diploma that you see on the upper left side of your screen, my magna cum laude diploma, and which I'm very proud of because it represents a number of things for me. It represents accomplishment, it represents success, completion, honor, relief, which you can see by the huge smile on my face. And not only because dental hygiene school is hard, and you may have already heard that, but also because of me. So let me back it up a little bit. I was born in Peru, and so English is my second language, first one being Spanish. So I had to take courses like organic chemistry, microbiology, and other tough classes in a second language. And let me tell you now, I was determined. I made it my mission to not just pass, but to excel. Not just because this is my personality, but also because it was really the only way to make it into dental hygiene school. I knew that there were lots of applicants. There were very high minimum scores to get accepted. And so excellence was not just an open call, but it was also a mandate. And so this picture right here represents a moment of, accomplishment of everything coming together. And so that's why I put it there for you. And also on the lower right side of your screen, you'll see my dental hygiene diploma given to me by the Michigan Board of Dentistry, which made everything very real for me. You do get a wallet-sized license in the mail, but this is just so much better. So that's why I put it up there for you. All right. So currently, my latest dental hygiene certificate, per se, is this vaccination record card, my COVID-19 vaccination card. I got my first dose for the Moderna vaccine on January the 13th, and it just made sense to me because dental hygienists are ranked at the highest level for COVID-19. So as you can see on the left side, hygienists are at the very top of the lists with dental assistants and dentists not too far down below on that list. So for me, this represents safety and comfort, and so that's why I had the vaccine, and so this is my most current certificate as far as dental hygiene. All right. So let's talk about my journey to becoming a dental hygienist. So what you see on the screen is the dental hygiene curriculum at OCC. There are a number of prerequisite courses that you have to take prior to applying for dental hygiene school. You have microbiology, human anatomy and physiology, biochemistry, composition, psychology, sociology. And after you take these prerequisites, you apply. And there are a number of other tests and paperwork to file in, but this is the essence of the application. Whether you are accepted or not will be based in a couple of fundamental factors, one of them being your scores on these prerequisite courses. Prior to this presentation, somebody asked me, tell me how I could make my application stand out. So for me, it would be make it personal. Stand out by making a mark by showing a personal side of yours. In my case, after I was done with all of the paperwork, I actually walked in person to the dental hygiene clinic at the Highland campus where I had my picture that I showed you earlier. And I asked to see the dental hygiene director at the time. And I handed her my application in person. I introduced myself. I said that this is me. I'm applying. I'm doing everything I can. And that's how I believe that had something to do with me being accepted. Of course, I'm not suggesting that all of you go and show up at your director's office door, because that would be way too many people. And at that point, none of you would stand out. It wouldn't be special anymore. But make yourself present somehow in a personal way, whether it might be by printing out a picture of something about you and slide it into your application paperwork that you're going to send in. Maybe send an email with a link to a video of you introducing yourself, somehow stand out in a personal way. It worked for me, and I hope that it might work for you. So anyway, I didn't have to wait to get into dental hygiene. I know there are waiting lists, and so some people, wait a long time. I was fortunate enough not having to wait, so I was very happy about that. So anyway, so I started in the fall, and I want to show you this list of courses because I want you guys, pre-dental hygienist students, to know what's coming. And for you guys, pre-dental students, I want you to know how we are trained and what we know, and, so that when you meet us in the workplace, you know what to expect from us. So I took in the fall dental anatomy, dental histology and embryology, clinical techniques. So this course here, at the end of this course, we all actually saw our first patients. So this is a very fast-paced program. Before you know it, you're going to be cleaning teeth. So get ready before you even start. And we also had dental office procedures. Next, in the winter, we had dental radiography. So you'll be taking Xrays. You'll be studying oral pathology, looking at tons of pictures of many oral diseases, and then there is more clinic for you. And in the winter term, I met the periodontics class. And this was very exciting for me because as soon as I learned about periodontics, I knew that I wanted to be a perio hygienist. I always thought of a perio hygienist as an elite group of hygienists, and I still feel that way, and I feel very honored because usually in perio you get very tough cases consistently, and I love the challenge. So that's when I met periodontics, and then in the spring, we took one class of dental materials. So pre-dental students, we are familiar with how you work to an extent, not same as you will be familiar with this, of course. You'll be studying this for years. So next we did more clinic, more patients, and then we learned local anesthesia. So depending on the state where you live, local anesthesia might be part of your curriculum or not. I was fortunate enough to learn about it in the spring term for me. In the fall, we learned dental therapeutics, dental health education, more clinic, more patients. In the winter, we study public health, dental specialty. So I got a little more perio over here, which I loved. Dental law, an optional dental hygiene board review course, and more clinic. So when everything is said and done, you are taking about 85 credit hours. So it's a lot of studying. So that is what you are in for. Okay, so let's go to the next slide. Now, what is my advice for college? So SOS is a widely recognized distress signal. It's Morse code. And in my case, it stands for schedule, organize, and support. So what are you going to schedule? You're going to schedule time. You're going to schedule time to study, time to work, and time to play. OCC recommends that you assign 2 hours per credit hour of class that you have. So if you're taking 12 credits that semester, you're going to need additional 24 hours to study a week. So all in all, that will be 36 hours a week just to study. And that's a full-time job. So you better make it part of your schedule because it's going to be there. It has to be there. So you're gonna schedule also time to work if you have to work. If you work while going through school, you are a saint. So kudos to you. And schedule time to play, because it's very easy to get sucked into the stress of having to study constantly and all the time. And if you don't separate time to play, you are going to lose your mind. So please schedule time to play as well. So organize. What are you going to organize? You're going to organize space, digital space and physical space. So on your computer, organize your school files in folders. Create folders and folders within folders to put away, slides that you get from class, PDFs. Make another folder for photos. Make another folder for screenshots that you take from class. If you're doing it all virtual, get organized, because it will make it easier for you to go back to that information and to use it later on. And it's just going to give you also peace of mind. And also organize physical space. You'll just feel much better if you work in a nice, clean, organized environment at home. It will reduce stress for you, and it will help you study better. And support, you have to have a support system, a personal support system at school, and a system at work as well. So at home, if you have a partner, a spouse, a fiance, boyfriend, girlfriend, make sure that they're on your side, that they have your back to help you get through school. At school, make sure that you have a group of classmates, not just for personal, not for personal support, but for that too. It's very important, because they are the only ones who know exactly what you're going through, because they're going through it with you. But also because you're going to need them for group projects. And so it's a functional relationship, but it's a very good one. And they might be your colleagues down the road when you hit the workplace. So you might start a support system forever. So that's what SOS stands for me, and that'll be my advice for college. All right, so on the note about scheduling time, I like being pretty organized as far as my schedule. This is my COVID-19 shutdown schedule. So once everything shut down because of the virus, coming from a full-time job to doing nothing, that was like a shock for me. I had to keep moving, keep doing something. And so I created this schedule, and I took into consideration everything I said, study, work, and play. So for example, in yellow, those are my food times. Very important. Make sure you're eating well, or as good as you can. And this pink area is a time that I separated to be with my husband, just talk about stuff and reconnect. So that was very good, especially over the shutdown. And down here at the bottom, you see that I separated a lot of time to just chill. And I hope that you have time to chill too, especially during school. And at the top, you'll see that I have a lot of time to just drink coffee and just be online. On that note, let me show you my favorite coffee mug. My husband got it for me. So anyway, I also have, in red, I have my study time. So during the shutdown, there were lots of, C credits available. So I took every one of them that I thought was interesting. So anyway, but my point is, make a schedule. And, put your work, your play, and your study times on the schedule, because your time is valuable, is very precious, and it should be accounted for. So anyway, so what is a dental hygienist? A dental hygienist is a primary care oral health professional. So let's stop right there for a second. So who is a primary care professional? A primary care professional is somebody who is oriented towards preventing disease, arresting disease in its initial stages, and reversing the progression of disease. So that's why a dental hygienist is said to be a primary oral health professional in this case. So on this definition by the American Dental Hygienists Association, it says a hygienist is a primary care oral health professional who has graduated from an accredited dental hygiene program in an institution of higher education, licensed in dental hygiene to provide education, assessment, research, administrative, diagnostic, preventive, and therapeutic services that support overall health through the promotion of optimal oral health. Now, this portion here, this list over here, those are the many roles that a dental hygienist can work on. You can be a clinician, like I am. You can be an entrepreneur, you can be an administrator, you can work in corporate, you can be a researcher. There are many things you can do, not just work in an operatory, although most of us do. So, and like it says here, is the end goal is to support overall health through the promotion of optimal oral health. So that's what a dental hygienist is. And what is a perio hygienist? I'm a perio hygienist. And what is it? It's a hygienist who works in periodontics. So there is no specialization in perio for dental hygienists. All hygienists are trained to see all kinds of patients. I just happen to work at a specialty office where almost every patient is a periodontally involved patient. So that's what a perio hygienist is. Now, let's talk about a typical day in dental hygiene. But before we get into that, I would like to share with you that there is a list of functions that we are legally allowed to do depending on the state where you live. And so let's go over this list. So first of all, number one, prophylaxis, which is what most people just call a cleaning. Xrays, local anesthesia, topical anesthesia, fluoride, sealants, root planing, soft tissue, curettage, nitrous impressions, perio dressings, sutures, dental hygiene diagnosis, treatment planning, assessment, and prescriptions. So according to the state where you are, there are going to be levels of supervision by the dentist in the office, whether that supervision is direct, indirect, or none at all. You need to learn that to know what you're allowed to do. So next, let's watch a little video of me having my prophy. So you get to see what it's like to do a cleaning. I know you all go to have your teeth cleaned, so let's just have fun watching this video of my prophy. Ready? So this is my cleaning during COVID-19. This is in July 2020. So this is hand scaling. No ultrasonic was used to avoid aerosol generating procedures. And this was okay because I'm a prophy patient, so there isn't like a lot of work that I need. And of course, there is a polishing. And a flossing, and that's it. So this cleaning was done during the pandemic. And on that note, I would like to say that this is, I know this is the reason why we are doing this shadowing virtually, because on-site shadowing is non-existent or restricted. So this is the best I can do to get you into an actual operatory room to watch a cleaning, in this case, one of mine. So I hope you like that. Okay, so a typical day in the life of a dental hygienist who is a clinician will be filled with dental cleanings. And so this is a breakdown of a dental cleaning appointment pre-COVID, right here on the right side. So let's go over this list. So we break it down, it's broken down into minutes, which is very helpful. So you introduce yourself, see the patient, get their chief complaint, update their medical history, take their vitals, take their Xrays, get them all geared up, do the periodontal assessments and cancer screening, do the actual prophy, polish and floss, just like you just saw on the video on the previous slide. And this is the doctor exam, and I highlighted it because for all of you pre-dental students, I want you to remember this. If you can stay there for no more than 5 minutes, we are really going to appreciate it. Thank you. Next, we are going to do a treatment plan entry. So just enter data on the computer, our clinical notes. Give oral hygiene instructions, maybe place fluoride, set up their appointments as complete on their computer, set up their next cleaning appointment, dismiss the patient, walk them out or hand them off to the front office, tear down and set up the room all over again. And this starts all over every 60 minutes. So this is what we do back to back to back to back, except for, the lunch hour. So this is pre-COVID, and this might still be the case post-COVID, and mostly at a general dentist office. But here on the left side, this is an appointment breakdown that I created. One second. In June of 2020, right when dental offices came back from the shutdown, and everything was brand new. So I had to create this breakdown to know exactly what I was doing. So it all starts with me setting up my timer for 60 minutes. So then I will go to the door and pick up the pre-screened patient, take their temperatures at the door, and then drop them off in my chair. Then I would go and put on my enhanced PPE, which includes a popper. We'll talk about it a little bit later. And then I would have them rinse with chlorhexidine, take their health history, take their blood pressure, and their oxygen levels. And then I would do the actual cleaning. And of course, this portion here would vary if this is a regular periodontal maintenance cleaning or an scaling and root planning appointment. In that case, this time would be double, triple, or quadruple. And right when we came back, the CDC had advised to wait 15 minutes right after the cleaning. And where I am, we're fortunate enough that even though this requirement is not current, that we still have this time to, to wait. And during that time, of course, I stay busy. I schedule the patient's next appointment. I write down my clinical notes. I dismiss the patient, and I take off my enhanced PPE and my popper. And once the patient is gone, I clean and I sterilize my instruments and clean my room. And then I prepare my room for the next patient. So this is a 70-minute appointment here. And this is what I do all day long. So that's my typical day. All right, so just to review, all dental offices right now are following the new COVID-19 protocols, everyone, including us dental hygienists, which includes screening not only of the patient, but also of us. So, so that everybody stays safe. It also includes enhanced infection control protocols and enhanced PPE. In periodontics, though, we do a couple of extra things consistently. We do what is called a full periodontal chart. It's very important for us to know about their periodontal health, and also external communication. After every patient, we write a report to the patient's general dentist to tell them about the periodontal health of the patient, to share Xrays, to share periodontal charts, intraoral photographs, to make recommendations and seek advice for restorative treatment that the patient may need, and that kind of thing. So we are, being a specialty office, we are constantly communicating with other professionals, other offices. So this is one thing that we do consistently. So what kinds of treatment needs our patients present with? So seeing is believing, right? So our patients become aware of their periodontal needs by things that they can see. Things that they can see for themselves are gingival recession and bleeding gums. So most patients will go to their general dentist first, or they might come all by themselves to the perio office and say, hey, I have a gum problem. And they do their Google research or whatever and say, I'm supposed to be here at a perio office so that you can help me. And there is what the general dentist usually sees, or even the dental hygienist at the general dentist office. So if they detect deep probing depths when they do their assessments, or if they see bone loss in radiographs that goes beyond a threshold that they know belongs to a periodontal office, then they refer patients to us, and that's why they come to our office. So what kind of procedures do dental hygienists perform? Well, this hygienist, most of the time, I do what is called a periodontal maintenance, which is the average cleaning at our office because most patients are periodontally involved. About 30% of the time, I perform what is called scaling and root planning. We do implant debridement, prophylaxis, which is a cleaning for the non-periodontally involved patient. I do regularly local anesthesia, administer nitrous oxide, and I take Xrays. So let's talk about diagnostic tests and instruments that we use. So as dental hygienists, we have access to what is called the dental hygiene diagnosis, which is about identifying oral health problems that the dental hygienist is licensed to treat. And that diagnosis will be based on assessment. And for assessment, we use a mirror, probe, and an explorer. And in the case of a Perio Hygienist, a dental probe is everything. So this right here is my PCP-12 probe, which has markings at the 3, 6, 9, and 12 millimeter. So this is what I use the most consistently for assessments and diagnosis. As far as other instruments, we use ultrasonic scalers, hand scalers and curettes, and hand pieces. So if you are already into dental hygiene school, or if you are a hygienist, you're looking at this picture, this is probably making your heart beat faster out of happiness, because this is just a beautiful sight of instruments. So the first group of instruments over here are for assessment. And this is my regular tray. And with this, I can do SRP or periodontal maintenance. So let's go over each one of them. So this is my mirror, double-sided mirror. And the handle ideally should be a large circumference handle for ergonomic reasons. Over the course of your career, you're going to be holding each one of these instruments for thousands of hours. So you better be sure that they're comfortable. Next is my PCP-12 probe. This is my 11-12 Explorer. So this long extended shank will be perfect to reach all the way down to the bottom of those deep pockets. And it will be perfect for me to feel for calculus all the way down to the bottom. So I know where I need to work. This is a 3CH Explorer. It's shorter, and this is perfect to look for cavities. This is the Neighbors Furcation Probe, and it also has markings, and it will make it easier for you to determine what furcation grade each tooth has. So this one here, this is the H67 anterior sickle scaler. So this is to scale anterior teeth above the CEJ. And this is a universal curette, my Columbia 1314. This has a rounded toe at the end of the working end. And over here, these are my area-specific Gracie curettes. So one thing you may notice is that this shank over here will go from straight to curvier as you go towards the back of the mouth. So this is my Gracie 1-2 for lower anterior and maxillary anterior teeth, of course. And if the anatomy, it's a little tricky or curvy, I might switch back and forth with my 11-12 for anterior teeth. This 12-13, I myself use it for premolars. This Gracie 7-8 I use for the buccal and the linguals of posterior teeth. This is the Gracie 15-16. This is perfect for the mesial, buccal, and lingual surfaces of posterior teeth. This is the Gracie 13-14, which is for the distals of posterior teeth. And this little guy is a sickle scaler for anterior teeth. So this is a good partner for this little guy over here if I'm getting into very tight spaces. So this is a beautiful set, guys, and I hope that you get your set of favorite instruments also. So before I get to use the hand scalers that we just saw, I regularly would start with these ultrasonic inserts. So this would be a universal one. And in periodontics, because we're dealing with deep gum pockets, the flushing action that you get from the ultrasonic is going to be extra important. So this working without ultrasonics is it's very difficult. The patient would really benefit from these ultrasonics at their every clinic. So anyway, so this is the universal one. And these three guys over here is what I would definitely use for SRP. So as you can see, the tip of this ultrasonic insert is fairly thin compared to this guy. This is the beaver tail. And this is the triple band ultrasonic insert. So when I start my SRPs, I would start with this guy, then follow with this guy, then finish up with my diamond-coated ultrasonic insert. And so that's it for the ultrasonic inserts. Now, before we start SRPs, and sometimes for periodontal maintenance, depending on the pain level of the patient, I do local anesthesia. So typically I use Articaine, which is long lasting, about 6 hours. And we use, I regularly use the 27 long needle for the inferior alveolar nerve block. And pretty much for everything else, I use the 30 short. And this is a petite syringe because I have very small hands. And these little butterfly wings are perfect for me to hold the syringe securely. So another thing that I do regularly is administer nitrous oxide. So this is the dose piece. And this is part of pain management because you want patients to be comfortable. And typically at the peri office, because we have harder patients, harder cases, I should say, they might be a little bit more apprehensive because they are going to get more work done. So we use this pretty regularly. So for a prophy or a cleaning on a patient who is not periodontally involved or has just localized perio, I might use a kit like this. This is the First Line Universal Kit by PDT. And this is meant to be used in conjunction with your regular set, but they have thicker shanks and working ends because they are more heavy duty. So if you can't use an ultrasonic on a patient because they just don't like it or they don't want it, gives them pain, anything, you can resource to a set like this instead, and then move on to a regular set of scalers. And at the end of a periodontal maintenance or a prophy, you would use your handpiece to polish, and then you would floss. All right, so let's talk about the new technology in dental hygiene. So this is me wearing a PAPR. A PAPR is a power air purifier respirator. So this is how it works. So this device is comprised of 3 parts. It has a blower, it has a breathing tube, and it has a headpiece. So air from the room is sucked into a filter inside this blower, and then that purified air is moved through this hose into the headpiece. So you are constantly breathing purified air. And why am I not wearing just an A95? So I took the fit test and I took it 3 times and I couldn't pass. Apparently my head or my face is just too small or it's just not the right shape or size. I couldn't get a perfect seal around the A95. And so that's why I wear this popper. And so it's been a blessing. It's very light and I feel very safe because I know I'm very safe with it. Another piece of technology right here you see is the loops. So these are magnifying lenses attached to safety glasses to see things up close without having to hunch over. And so this will be very good for ergonomics and for your performance as well. And this particular one has a wireless light on it. So I just wave my hand over it and it turns on and off. So there are no cables to touch, which is another infection control measure that I enjoy out of this one. And so it doesn't have a cable coming out of it that I have to touch to turn on and off. So that was very helpful. And a side note, this is just for the picture. My head, my hair is usually wrapped and hiding behind a scrub cap. So, and this is a water repellent, water resistant gown. So this is all courtesy of COVID-19, of course. And on that note, aerosol control has brought new technology into dental hygiene. There are isolation systems like a dry shield and relief, which basically consists of mouthpieces that will suction out the aerosols generated by your dental procedures. There are also hand instruments to avoid aerosols, like the first line kit that we just saw on the previous slides. There are digital Xrays and intraoral cameras. And there is dental software like Dentrex and My Dental Click to store and manage health information. So important terms in dental hygiene for me. Prophylaxis. Prophylaxis is preventive in nature and includes a scaling and polishing of tooth structures with the removal of plaque, calculus, and stains. The removal of all calculus and plaque above the CEJ is part of a prophylaxis. Pseudopockets may be present, but there should not be bone loss or loss of attachment. If there is any of that present, that's a perio patient. So what is scaling and root planing, also known as SRP? Is the instrumentation of the crown and root surfaces of the teeth to remove plaque and calculus from these surfaces. It is indicated for patients with periodontal disease and is therapeutic, not prophylactic in nature. Root planing is a definitive procedure designed for the removal of cementum and dentin that is rough and or permeated by calculus or contaminated with toxins or microorganisms. So this is the most thorough cleaning that anybody can get. All right. Once we have a clean slate created by SRP, periodontal maintenance will follow. This procedure is instituted following periodontal therapy in the form of SRP or periodontal surgery, and continues at varying intervals determined by the clinical evaluation of the dentist for the life of the dentitions or any implant replacements. It includes removal of the bacterial plaque and calculus from supragingival and subgingival regions, site-specific scaling and root planning where indicated, and polishing the teeth. So the only time you don't polish while providing these services would be during SRP. Okay, now let's talk about a case of SRP. So what do you think it would take to clean this up? Probably pain, anxiety, heavy-duty tools. So the answer is SRP. So I'm gonna give you a list of every step of an SRP procedure. So the number one thing you would do is explain. If somebody has this in their mouth, they know that in order to remove it, it's likely gonna hurt. That's what they have in their minds. So they are anxious, and anxiety is fear of the unknown. So the more information you give them from the get-go, you're gonna ease off their anxiety. So explain what you're gonna do step by step. So that's what I do. I first explain, and then we might start the nitrous, and sometimes they may already take oral sedation, which is to help them relax even before they come to the office. So, so you start the nitrous, and then you apply topical anesthetics on the soft tissue regions where you'll be applying local anesthesia. So that will be next. And after I have applied that, I wait for it to kick in, of course. And then I tell the patient, okay, next I'm going to explore very lightly to make sure that your teeth are properly anesthetized. And you'll come up with your own spiels, and but this is mine. So I tell them that because I want them to know that their comfort is my priority. So I do explore very lightly, and if there is a need for more local anesthesia, I apply that. And if we are ready, then we get going. I start with my ultrasonic inserts, like the triple band, the beaver tail, the heavy duty ones, for sure for this case. And then I go in with my Xrays because you know that this calculus here extends well beyond the gum line, way down here. So, and then I use my supragingival scalers, and then I finish up with my diamond coated ultrasonic inserts, so everything is pristine and perfect. And after that, I explore again to make sure that everything is good. And a lot of times, I'm gonna take an X-ray if there was radiographic X-ray, if there was a calculus and X-ray to begin with. So I would take like a comparison picture. And so I would also explore by hand to make sure that there is no detectable calculus left behind. And once I'm done, I explain again to the patient what's going to happen next. I tell them what's numb in the mouth so that they know what to expect for the rest of the day or the next 6 hours. I tell them, okay, these areas of your teeth are numb. These soft tissue areas are numb. Your cheek, the side of your nose, even your eyelid might be a little numb. Just so that they know. And that makes them feel better. So we give them an instruction sheet so that they can read about it later and remember everything. And so once that's done, we bring them back in about 4 to 6 weeks to see the results. And we might see something like this. So that's SRP. Now, a big part of what we do as dental hygienists is provide oral hygiene instructions, also called OHI. And at a perio office, we see a lot of patients with implants. And as part of the implant maintenance, we need to provide specialized oral hygiene instructions. So we go way beyond regular brushing and flossing. So in this case, for example, here is an implant care kit. And so let's start with this one here. This is an end tough brush. So this curved shank will be perfect to run this brush towards around the lingual surfaces of this implant retained denture in here. Then you have a circular brush, which is a brush with a thin line of bristles. And so this will be perfect to run it along the edges of the front portion of this denture here. And then you have Proxa brushes, and they will be used in between implants or in between implants and teeth. And you will use the width that fits the space, of course, and nothing more, nothing less. And you can also give them soft picks, which they can carry as toothpicks, so they can remove plaque on the go. But this will be softer because this is plastic. And then there is this tufted floss. So this particular one, you can wrap it around the implant abutment in a crisscross shape like this, and you floss the entire circumference of this implant abutment. So this is just what our patients need, whenever they have implants. All right, so what is my advice for work? A picture is worth 1,000 words. So if either use a picture or use 1,000 words. So this has to do with clinical notes, with how you communicate with other specialists, other dentists, and also for your own record keeping, so that when you go back and you see that patient again, you know exactly where you left off. And you're not gonna miss any detail. It's, in the beginning, like you are gonna remember everything, but as time goes by, you'll realize this patient is back and I don't remember any of this. So if you have a picture like this that you can take with an intraoral camera like this one that I have at work, this might be very helpful. It might be also helpful for the patient to show them, the full extent of their periodontal health. A lot of times they don't realize, like sometimes this person might be just brushing the crown surfaces of the teeth. But if you show them this picture, you might be able to tell them, okay, make sure that you run the toothbrush along the gum line. And remember, the gum line for you is much lower than you think, as you can see in this picture. And another type of a graphic that you can get, of course, are X-rays. And of course, we have digital X-rays where I am, but a lot of offices are still using film. But if you don't have any of these technology, like I said, if you can use a picture, use 1,000 words. So every resource is available to you. So here's a quote for you, future dentists and the future dental hygienists out there. If you're a student, find a way, make it happen. You'll make it happen. Just stay the course. You'll be okay. Just find a way. And once you get to be a clinician, lead the way. All right, so time to announce the giveaway. So I have a tooth shower here, which is a water flosser for the shower. And cool fact about this, it was created by our dental hygienist. So this picture shows what it does. So it connects to your shower head. So this is for people who are truly committed to oral health and like you and me. So this is perfect for you. So all you have to do for a chance to win this is like this post on my Instagram and comment attended, and also follow Tooth Shower on Instagram. This giveaway ends today at 8 p.m. Eastern, so don't run away just yet. We're gonna do the Q&A section next, and then you'll have time to go do this on social media. And so with that, let's start the questions and answers section.
Awesome. Sounds great. And first, I just want to say thank you, Miss Edith, for the wonderful presentation and for taking all the time to prepare that for us. I think it was very helpful to all the pre-dental hygienist followers we have, as well as pre-dental students. So yeah, as you mentioned, we'll go ahead and start the Q&A now.
Mm-hmm. All right, so the first question is, what made you choose dental hygiene over general dentistry?
Oh, that's a very good question. And the honest answer is the level of responsibility. There is only so much I wanted to take on. So this is a call for our pre-dental students out there. We rely on you for a lot, and a lot of things will only be done on our end only if you give us the green light or the instructions for it. So yeah, basically it was because of the level of responsibility I felt okay taking on. Mm-hmm.
Awesome. The next question is, someone asked, I want to work in a pediatric special needs. Have you tried working in that specialty?
So I saw children as patients during my first year in practice right out of the school, and it's wonderful. I love children. It's just so much fun. A lot of times I find myself talking to my perio patients like I would to a child. Anyway, I haven't worked at an actual pedo office myself, but I highly recommend it. I talked to a periodontist, and he mentioned that it would be wonderful if there was an actual specialty to treat special needs patient. I haven't had that chance very often with children. I do see perio patients with special needs, who have had TBIs, traumatic brain injuries, cerebral palsy, Down syndrome, and when those kind of cases come to us, a lot of times we can do it all by ourselves, or sometimes we might get the help of a dental assistant. So it's a wonderful category of care, and I do get my share of it, but that's not my specialty.
Mm-hmm. Yeah, and then someone asked, patients often extensively question and disagree with the dental hygienist. How would you handle a difficult patient?
So kill them with kindness. Kill them with kindness. Sometimes it's gonna be very hard because you yourself, have been working 8 hours in a row already, but take a deep breath and you'll be so surprised how much they calm down when they come at you with anger or something like that, some kind of emotion. But if you just take a deep breath or leave the room for a moment and then come back, and you'll be okay. You'll be okay. I would say the bottom line would be kill them with kindness.
Yes, for sure. What COVID-19 induced adjustment was the most difficult for your clinic to implement, and how did this affect your personal work ethic?
So, well, there are a ton of things that are new because of COVID at work. I think the toughest adjustment would be, the masks, the N95 masks, which my colleagues have to wear. I am so blessed and fortunate that I get to wear my popper, and I breathe fresh air the whole time. But also, so issues around the masks, not just for us, but also for patients who sometimes, don't want to wear it or don't want to wear it correctly. They come in with the masks behind their noses, or they talk on the phone in the chair and they pull down the mask completely to talk. And so I would say issues around the mask for sure. It's very tough for patients to wear masks all the time because they are not used to it. We're trained to, but for them it's a little bit harder. So just patience, I would say, to to try and get around that. Just patience.
Mm-hmm. And actually, a lot of people were curious about the picture that you showed with the suit on, the PPE on. Yeah, so they were wondering what it was for, if you could describe it or explain.
Oh, yeah, the one where I'm wearing the popper.
Yes, that picture.
Yeah, so yeah, for sure. Let's see. I'm gonna scroll backwards. All right, so here.
Yeah.
So this is a 3M popper. It's a T300 plus.
Mm-hmm.
It weighs about a pound. And so it's very light. Prior to this one, I wore one by 4, which weighed a little bit over 6 pounds. So this was a blessing. So so the way this works is there's a filter inside of this, much like your furnace filter, but tiny. And there is a motor inside of there as well. This down here, this is the battery that I just clip on and off. So this filter in here for me, for what I do, is gonna be okay in there for about a year. And so it filters the air from the room, sucks the air in from the room into this vent down here, goes into this blower with the filter inside of it, passes it and purifies it through the filter, and then it moves it into this breathing tube. And this it connects to this helmet or headpiece. And so it's pumping in fresh, purified air inside of this space all the time. And under my chin, in this area, there are tiny little openings through which the air is expelled out. So it never fogs up. And there are different designs of headpieces. This particular one doesn't cover my ears, which is good for a couple of things, so that you can adjust your eyewear, and also so that you can hear patients. So with this unit, there's gonna be some noise around your ears, and it's gonna be just a tad harder to listen to patients. Not impossible, not super hard, but there's gonna be a buzzing noise around your ears. So that's why before I put it on, I have a talk with the patient with just a regular procedural mask, and I discuss what they need, their concerns. We have every conversation we need to have before I put it on, so that we keep it to a minimum once the noise is running in my ear. And so that's about the popper. Hopefully that answers the question.
Yeah, people are just wondering, is that you in the picture?
Yes. And if you go to my Instagram page, you'll see several more pictures, and you'll also see, you'll be able to watch a little video.
Okay, nice.
So, yeah, you'll be able to hear the little humming noise.
Awesome. I think that's it for the questions.
Okay. Well,
Awesome, great.
so
Well, thank you again, Miss Edith.
yes, thank
And
you, guys.
And everyone, make sure to go to her Instagram page, give her a follow, and make sure to comment attended, right, in the comments.
Yes, make sure to comment attended, and so that you can get a chance to win this tooth shower. And the giveaway ends today at 8 p.m. and the winner will be announced right away in the comments of this post. So that's
Awesome.
it.
Amazing. Thank you so much. And thank you to everyone for attending. We hope you got a lot of great dental hygienist knowledge, and we hope you all have a wonderful night, and we'll see you at our next virtual shadowing session.
Thank
Bye,
you,
everyone.